Global world leaders have come together for the 78th World Health Assembly, setting stage for bold decisions in healthcare systems. Now, with challenges like pandemics and climate change on the rise, collective action has never been more critical. We are standing at a point where the decisions that will shape the future of healthcare in the world are made.
Climate change is reshaping our world and our health. As temperatures rise, so does the threat of neglected tropical diseases.
Number one, you'll find that quite a number of these neglected tropical diseases are vector-borne. They are transmitted from person to person by small insects and other small organisms which now act as vectors. Now, climate change has a profound impact on the distribution and general dynamics of these vectors. So we are seeing a situation where there is a big upsurge in some of these diseases. For example, we are seeing bigger outbreaks of leishmaniasis, for example. When you compare with the previous years, you find that now we are seeing a much bigger impact because probably we are actually attributing it probably to climate change, of course, among other factors.
Imagine entire generations in Mali who will never know the agony of trachoma blindness. Communities in Niger freed from the scourge of river blindness. This isn't just progress, it's a revolution in global health equity.
56 countries have eliminated at least one neglected tropical disease. That is an impressive metric. And it is important that we remember what this has meant to communities. Communities that have suffered for generations with these diseases. We celebrate the fact that a country like Mali, with all the challenges that it has faced, is on this list. Almost the entire country was endemic for trachoma. But thanks to the government commitment in Mali and a broad coalition of partners, including WHO, the International Trachoma Initiative, Pfizer, and a broad range of partners supporting them, Mali was able to free its population from the risk of blindness due to trachoma. We celebrate Niger, the first African country to eliminate onchocerciasis.
Nowhere is this revolution clearer than in Kenya, where science, strategy, and sheer determination are rewriting the rules of disease elimination.
Number one, we have already been certified free of guinea worm disease, which is one of the NTDs. This one we did in 2018, where the WHO team came and assessed and certified us as guinea worm free. So we are listed as having eradicated. Number two, we recently passed the transmission assessment surveys for elimination of lymphatic filariasis, which we have actually run one of the best campaigns globally. Kenya is viewed as a model when it comes to the elimination process of lymphatic filariasis, because when we went down to our coast, we were not doing very well in 2015, but then we came in with a very effective campaign. And when the Washington State University carried out a study that showed that there was a regimen that we could use to reduce the duration of elimination from 5 years to 2 years, we embraced it as Kenya. We brought in all the partners, we deployed it successfully, and now we have already passed the transmission assessment survey. We are actually just awaiting certification as having eliminated lymphatic filariasis. We are also doing very well in terms of seeking certification for verification for elimination of onchocerciasis as well as sleeping sickness. So we are doing extremely well. We are on track with regard to trachoma, elimination of trachoma. So I think as a country we are doing very well.
But progress isn't just fought in clinics and labs. It's won in the hearts and minds. When myths run deeper than medicine, innovation becomes just as crucial as science.
Behavior is one of the biggest public health problems when it comes to NTDs, because cultural beliefs are a big impediment to interventions, are a big impediment when it comes to disease prevention, when it comes to health promotion generally. But what we have done, and this one we started in 2015, when we discovered that one of the hardest hit NTDs was lymphatic filariasis, where people believed very many things about the transmission of lymphatic filariasis. Some thought it's a sexually transmitted disease. Some thought it is witchcraft, which applies to very many other NTDs. We had to come in with very effective, cutting-edge approaches towards reaching out to the community. We discovered new ways of being able to reach out, so that we conducted a very aggressive advocacy, communication, and social mobilization strategy with in partnership with some of the best practitioners in the world. I could state people like Alison Krentel from Canada, who came in, and we were able to co-create a very, very effective SESM strategy to advance our advocacy.
To break these barriers, Kenya's team became storytellers, crafting messages that resonate with their target communities.
We were able to, segregate the population so that we looked at every demographic differently, and we looked at which are the approaches that work best for each demographic. Because what works for a woman in the community might not work well for a young boy in the community, a teenage boy. What works for an old man might not be what works for a small child. For a school child might not be what works for a tout. So we looked at very many different approaches, and we diversified, because before that we were really depending on mainstream media, radio, newspapers, and posters. But then we discovered there was a place for community engagement, direct. There was a very big place for how to alter, so that even now when we use the radio, how do we deliver for different demographics? And that has helped us a lot. So we are employing a whole of government, whole of society approach, where our researchers, our private sector, all the sectors, including agriculture, livestock, water, all the sectors are involved. And this we have worked very closely with WHO to be able to achieve.
The numbers sting. With vanishing budgets and retreating donors, Africa has never been better equipped to win. With billions of treatments pledged and communities now empowered as first responders, Africa is ready to rewrite the rules. For Willow Special Reports, my name is Yvonne Kawira.